My name is Humphrey Gide. I am a retired doctor, but I've kept an interest in medical decision making. That is, how doctors come to make decisions about the problems that they face. Over the last 50 years, a number of individuals have made remarkable contributions to assisting medical decision making. And these have taken the form of special slide rules, punch card systems, and of course computer programs. They've also been published in journals and in books. Over the last 50 years, inevitably, a number of them have died. And it became clear to me that it would be valuable to make an oral history archive, that is to say, to interview the remaining members as soon as practicable. This has now been done. Yes. So at some point during that period before you knew him, he had developed this idea of putting the data in terms of signs and symptoms onto the strips and reading off sort of sideways on the cursor.
Yes. I think he was trying to find some way to correlate what was happening with this particular symptom, where it had occurred in various diseases, because he used things like French's Index and all these sorts of books, and he did it on a card system, I think. And in fact, I have got somewhere a great big tome where for each symptom we have every single, or for each diagnosis we have every symptom that has been described. Some of them are on the logoscope and some aren't, because the logoscope's only got 82. And he chose those 82, because I said to him, why don't you have some more? Because the sort of comment would come from doctors, say, there's nothing on here about deafness, or there's nothing on here about such and such. And Pat said, well, what does he want to know about that for? There's only about 3 causes of deafness. You know, he can remember those, but on the logoscope there's about 100 causes of headache. So he only used the ones that had a large number of causes, because he said they were the burden on the doctor's mind. That was his term.
A good point.